Hypercalcemia is a condition where there is too much calcium in the blood. This excess calcium can disrupt the normal balance of minerals in the body. Calcium is essential for many bodily functions, including the maintenance of strong bones and teeth. These include muscle contraction, nerve function, and blood clotting. It also plays a role in cellular signaling and hormone release. However, high calcium levels can cause significant problems affecting various bodily systems. The normal range for blood calcium is 9 to 10.5 milligrams per deciliter. Maintaining this range is crucial for health. Levels above 10.5 milligrams per deciliter indicate hypercalcemia, which needs medical attention. This condition is a serious electrolyte imbalance that can disrupt normal bodily functions. It requires prompt recognition and treatment to prevent complications. Untreated hypercalcemia can lead to various complications such as kidney stones and bone pain. It can affect multiple organ systems including the kidneys, bones, and heart. Nurses play a crucial role in early identification and management of hypercalcemia. This ensures the best possible outcomes for patients, improving their quality of life. Hypercalcemia often results from underlying medical conditions, such as hyperparathyroidism or cancer. It can also be a side effect of certain medications like diuretics or lithium. Understanding the causes, symptoms, and management strategies is vital for nurses to provide effective care. This knowledge equips them to provide optimal care for patients with hypercalcemia, ensuring better health outcomes. Hypercalcemia has various causes, each contributing to elevated blood calcium levels. Understanding these causes is crucial for effective diagnosis and treatment. One common cause is hyperparathyroidism, a condition that needs careful monitoring. This condition involves overactive parathyroid glands, which are small glands located in the neck. These glands regulate calcium levels in the body by producing parathyroid hormone, or PTH. When overactive, they produce too much PTH, leading to an imbalance. This excess PTH leads to increased calcium release from bones into the bloodstream, weakening the bones over time. Malignancies, particularly cancers that spread to bones, can also trigger hypercalcemia, complicating the patient's condition. These cancers release substances that break down bone tissue, a process that needs to be managed carefully. This process, known as osteolysis, releases calcium into the blood, further elevating calcium levels. Certain medications like thiazide diuretics contribute to hypercalcemia by increasing calcium reabsorption in the kidneys, which can be a side effect. Excessive intake of calcium or vitamin D supplements can also elevate blood calcium levels, especially if taken without medical supervision. Vitamin D promotes calcium absorption from the gut, which is beneficial in the right amounts. Overconsumption can lead to excessive calcium buildup in the blood, causing potential health issues. Prolonged immobility, such as bed rest, can contribute to hypercalcemia, especially in patients with limited movement. Without weight-bearing activity, bones release calcium into the bloodstream, highlighting the importance of physical activity. Hypercalcemia exerts significant effects on the cardiovascular system. The heart relies on a delicate balance of electrolytes including calcium for proper function. High calcium levels disrupt this balance, leading to various cardiac abnormalities. Initially, hypercalcemia may cause tachycardia, a rapid heart rate. As calcium levels rise further, they can depress cardiac contractility, leading to bradycardia, a slow heart rate. This slowing effect on the heart can be dangerous, especially in individuals with pre-existing heart conditions. Hypercalcemia also affects blood vessels. It can contribute to hypertension or high blood pressure. The excess calcium in the blood disrupts the normal flow of fluids across blood vessel walls. This disruption can increase the resistance to blood flow, leading to elevated blood pressure. Furthermore, hypercalcemia can exacerbate existing hypertension, making it more challenging to manage. Monitoring blood pressure regularly is crucial in patients with hypercalcemia. Hypercalcemia significantly impacts the nervous system and muscle function, leading to a variety of complications. Calcium plays a critical role in nerve impulse transmission and muscle contraction, acting as a key messenger in these processes. Elevated calcium levels disrupt these processes, leading to a range of neuromuscular symptoms, including muscle weakness and fatigue. One of the early signs of hypercalcemia is muscle weakness, which can be subtle at first but progressively worsens. This weakness occurs because high calcium levels interfere with the normal interaction between nerves and muscles, disrupting their communication. As calcium levels rise, muscle weakness can worsen, affecting mobility and coordination, making daily activities challenging. Patients may experience difficulty with activities such as walking, gripping objects, or even lifting their limbs, impacting their quality of life. In severe cases, hypercalcemia can lead to muscle paralysis, a serious condition requiring immediate medical attention. Hypercalcemia can also cause decreased deep tendon reflexes, which are critical for diagnosing nervous system issues. These reflexes, tested by tapping on tendons with a reflex hammer, are essential indicators of nervous system function and health. Diminished reflexes suggest impaired nerve conduction due to elevated calcium levels, highlighting the need for careful monitoring. It's crucial to assess and monitor these reflexes in patients with hypercalcemia to prevent further complications and ensure timely treatment. While hypercalcemia primarily affects the cardiovascular, neuromuscular, and renal systems, it can also have implications for respiratory function in severe cases. High calcium levels can depress the central nervous system, including the area that controls breathing. This depression can lead to hypoventilation, a condition where breathing becomes slow and shallow. Hypoventilation reduces the amount of oxygen taken in and carbon dioxide removed from the body. This imbalance can lead to respiratory acidosis, a buildup of acid in the blood. In severe cases, hypercalcemia-induced respiratory depression can progress to respiratory failure. This life-threatening condition requires immediate medical intervention. Nurses should be vigilant in monitoring respiratory rate, rhythm, and effort in patients with hypercalcemia, especially those with pre-existing respiratory conditions. Any signs of respiratory distress, such as shortness of breath, rapid breathing, or changes in consciousness, should be reported promptly to the healthcare team. Section 6. Gastrointestinal Complications. Hypercalcemia can manifest in various gastrointestinal symptoms, often causing discomfort and disrupting normal digestive processes. One common symptom is constipation, resulting from slowed bowel movements. High calcium levels can interfere with the smooth muscle contractions in the intestines that propel food through the digestive tract. This slowing can lead to stool hardening and difficulty passing bowel movements. Patients may also experience nausea and vomiting, contributing to discomfort and potential dehydration. The exact mechanisms behind these symptoms are not fully understood, but are thought to involve calcium's effects on the nerves and muscles in the digestive system. Hypercalcemia can also reduce appetite, leading to decreased food intake and potential nutritional deficiencies. Addressing these gastrointestinal symptoms is crucial for patient comfort and overall well-being. Nurses play a vital role in managing these symptoms through dietary modifications, hydration, and medication as needed. Section 7. Renal Manifestations. Hypercalcemia can significantly impact the kidneys, leading to various complications. The kidneys filter waste products from the blood, including calcium. High calcium levels can overwhelm the kidney's filtering capacity, leading to a condition called hypercalciuria, where excessive calcium is excreted in the urine. This excess calcium can precipitate in the kidneys, forming kidney stones. Kidney stones are hard deposits that can cause severe pain, urinary tract infections, and even kidney damage. Hypercalcemia can also impair the kidney's ability to concentrate urine, leading to increased urine output and dehydration. Prolonged hypercalcemia can cause irreversible kidney damage. Monitoring urine output, kidney function tests, and signs of kidney stones, such as flank pain and blood in the urine, is crucial in patients with hypercalcemia. Section 8. Skeletal System Concerns. Hypercalcemia has significant implications for bone health. Bones store the majority of the body's calcium. When blood calcium levels rise, the body may pull calcium from the bones to restore balance. This process can weaken bones over time, increasing the risk of fractures. Patients with hypercalcemia may experience bone pain and tenderness. They are also more susceptible to fractures, even from minor trauma. This increased fracture risk is a significant concern, especially in older adults who may already have weakened bones due to conditions like osteoporosis. Monitoring bone density and implementing fall prevention measures are essential in managing the skeletal complications of hypercalcemia. Section 9. Nursing Assessment and Management. Nurses are essential in recognizing and managing hypercalcemia. Assessment involves a thorough history and physical examination. Pay close attention to signs and symptoms like muscle weakness, constipation, and confusion. Monitor vital signs, especially heart rate and rhythm. Lab tests like serum calcium levels are crucial for diagnosis. Management focuses on lowering blood calcium levels and treating the underlying cause. Fluid replacement is often the first step. Medications like calcitonin and bisphosphonates can help reduce calcium levels. Loop diuretics can promote calcium excretion. Dietary modifications, including limiting calcium intake, may be necessary. Closely monitor patients receiving treatment for hypercalcemia. Watch for medication side effects and potential complications. Patient education is crucial. Explain the condition, treatment, and importance of follow-up care.